Hi, my name is Olivia Quimby. I'm a student nurse at the University of South Alabama, and today I will be doing this IV saline lock checkoff. So now you're going to scan the room. So upon entering the room, I'm going to perform hand hygiene. I'm going to verify my order with the hospital policy. I'm also going to take my MAR and the patient's wristbands, and I'm going to identify the patient by using two identifiers. We have Mr. Jaguar Jones, date of birth August 25th, 1963, August 25th, 1963, and Mr. Jones has an allergy to penicillin, and he has a penicillin wristband as well. So now I'm going to gather all equipment needed for this procedure. I'm going to also explain the procedure to the patient, and I'm going to provide privacy. I'm going to also move the trash can where I'll need it for the procedure, and then after touching the trash can, I'm going to perform hand hygiene again. So now I'm going to don my goggles. And now I'm going to assess the patient and raise the bed to working height and lower the side rails, and I'm going to help the patient into a supine position or into a sitting position and make sure the patient is comfortable for the procedure. I'm also going to make sure that the privacy is maintained throughout the procedure as well. So now I'm going to open all of the equipment using sterile technique. So now I'm going to take my tape and I'm going to get out 3 pieces. Okay, now I'll set this aside. So now I'm going to take my alcohol swab, and I'm going to clean the cap of the port. I'm going to make sure to clean it all around. Now I'm going to dispose. So now I'm going to take the saline syringe and I'm going to unscrew it. And I'm going to first prime it, making sure it works correctly, and it does. Now I'm going to connect it and secure it using the Luer lock system, twist it on. Now I'm going to prime the end of the tubing, making sure not to touch the white part. Okay, it works. And now I'm going to loosen the cap, being sure to keep sterility. So now I'm going to place it back into the packaging, and I'm going to take my syringe and place it near the patient's arm and the tegaderm as well. So now I'm going to state 3 principles for finding a vein, and so in this I'm going to use the most distal part of the non-dominant arm. I'm looking for a large and spongy vein, and I'm being sure to avoid any bruises. Also 3 principles for fostering venous distension. This would be to lightly stroke the vein, also to apply warmth to vasodilate the vein, and then also to have the extremity in a dependent position. So now I'm going to apply my tourniquet, and I'm going to do this 4 to 6 inches above the planned insertion site. I'm going to make sure to get it tight, but it is a little difficult on a pool noodle. Okay, now that it's tight, I'm going to assess that the vein is not abnormal and that it is the correct, it's not too tight or not too loose. I'm also going to assess for the radial pulse, and so now I'm going to put on my gloves. So I'm going to just slip on my clean gloves. So now I'm going to move my Luer lock saline syringe closer to the patient for the procedure. Stay in. So now I'm going to take my chlorhexidine, and I would normally push the ends and open it, and I'm going to clean the area of insertion, and I'm going to do this in horizontal, vertical, and circular motions, applying friction, and I'll do this for 30 seconds, and then I will discard. I'm going to let this dry completely, and then now I'm going to take my syringe and I'm going to go ahead and open the cap in the sharps container, and now I'm going to anchor the area that I want to insert the IV. So I'm going to do this by using my fingers, and I am now preparing to insert my IV. I will do this with the bevel up at 10 to 30 degree angle, and I am going to insert it and make sure before I do this, I'm going to tell the patient to keep their arms steady and help me during this by keeping their arms steady, and just warn them that I'm about to stick them. So now I'm going to insert my needle. Once I see blood return, I'm going to lower the needle and insert a quarter more of an inch, and then I'm going to, without moving the needle, I'm going to insert the hub all the way to this patient's skin, and then I'm going to release the tourniquet. Now I'm going to apply pressure, and I'm going to remove the needle and discard it in the sharps container. So now I'm going to quickly unscrew the lid, the cap, and I'm going to put it on the catheter tip. Now that I know it's secure, I'm going to take a piece of tape and put it over the over the catheter tip, and I can release pressure. So now I'm going to aspirate for blood return, and then I would normally flush the fluid all the way, and I would observe for any swelling that were indicated or anything abnormal. But I'm not going to do that today. I'm just going to assume all is well, and I'm going to put my saline syringe in this sharps container. So now I'm going to take my Tegaderm drainage, and I'm going to remove the paper part and discard that as well. And be sure not to touch the sterile part, and I'm going to apply it over just the hub of the catheter, and I'm going to make sure it's secure and then I'm going to remove the edge and make sure all the edges are secure on the patient's arm. Okay, now I'm going to discard this as well. So now I'm going to remove the temporary tape, and I'm going to replace it by putting the extender in a normal position, and I'm going to put a piece of tape over it to secure it. So now I'm going to remove all of this material because I do not need it for the rest of this procedure, so I'll just push it aside. And now I'm going to remove my gloves, glove to glove, skin to skin. So now I'm going to take my label, and I'm going to label the Tegaderm dressing. And so I will do this by putting the date, time, and my initials on it. And I'm going to put it on the edge of the dressing, being sure not to cover the insertion site. So I'll do that now. And so now I'm going to position the patient comfortably and safely. I'm going to raise the bed, or lower the bed to the lowest setting, raise the side rails, and I'm going to instruct the patient that if, or teach the patient that if, to help not dislodge the IV. So I'm going to instruct that if the patient were to see slow or stopping of the fluid in the IV, that they would alert the nurse. If they were to see bleeding in the tubing or bleeding in the drainage, they would alert the nurse as well. And I would also ask the patient to help by securing or protecting the IV when moving, and then in the case of showering, to cover it with a wrap. And I'm also going to instruct the patient of signs and symptoms of complication. This could be infiltration, phlebitis, or inflammation. And so now I'm going to perform hand hygiene, and I'm going to document. So I'm documenting for the date, the time, the location, the amount or the number of attempts. I'm also documenting for the gauge and the length of the needle and catheter. I'm also documenting the patient's tolerance of the procedure, and also documenting the saline lock and the flow rate and the method of infusion of the fluid if it were prescribed. So now I think I'm ready to discontinue the catheter. So this is the aseptic procedure, so I'm going to put on just clean gloves. And I already have my goggles on, so I do not need to do that again. Okay, so first I'm going to remove, I'm going to stabilize the catheter and remove the tegaderm drainage. And I'm going to do this by pulling towards the insertion site. And I would discard that. I'm also going to remove the tape from on the catheter or the IV. And now I'm going to take a gauze and I'm going to put it over the hub, and I'm going to apply gentle pressure, and I'm going to remove or withdraw the IV parallel to the vein in gentle and smooth manner. Then I'm going to inspect the tip of the IV, making sure that it is intact, and then I'll put it in the sharps container. So now I'm going to apply pressure on the insertion area for about 30 seconds, and then I'm going to take a piece of tape and put it over the gauze and secure it like that. So now I'm going to observe for any signs and symptoms of complications, which could be redness, tenderness, swelling, or bleeding, and then I'm going to help the patient position him or herself into a comfortable position, and then I'm going to lower the bed to the lowest setting and raise the side rail and make sure the patient has the call light near them, and then I'm going to go to the nurse's station and document. And that is the end of this procedure. Thank you.